Writer and activist James Baldwin once stated, "Not everything that is faced can be changed, but nothing can be changed until it is faced." Today, we have the honor of engaging with a visionary leader and advocate who has made it his life's mission to empower and uplift the voices of Black transgender men with a focus on health care equity. Here to share with us the change he is making, we have Dr. Elijah Nicholas, who is the executive director of 100 Black Trans Men Incorporated. Thank you for joining us today, Dr. Elijah.
Thank you for having me. I'm grateful to be here.
Yes, and an important topic that we're discussing. I wanted to ask you just right off the bat, how do you see the concept of health equity unfolding in the context of transgender healthcare, and what does achieving true health equity look like for the transgender community?
Let's start with what true health equity is, right? So when we think about equitable access for transgender individuals, it means that we have the opportunity to go to the doctor, have an educated and informed provider, and we also have access to the health care we need, like gender affirming care.
Yeah.
And where I see this going is spaces like California can be a business model for our entire country, because we're in a time where we have so many bills against the trans experience, and it's just time to elevate beyond that.
And Dr. Elijah, in your experience, what are the most significant challenges and opportunities when it comes to achieving health equity for transgender individuals, especially in areas such as reproductive health and mental health?
Well, when we think about reproductive health, specifically for Black transgender men, it's important to think about the fact that Black women have the highest mortality rate during childbirth. Well, transgender men who are assigned the female sex at birth are a part of that demographic, and there's a lack of data and research on those things, as well as mental health. Some of the bills that are going on around right now, these bills actually want to take mental health out of trans health care, and so that's very important. Mental health is very important for us.
Yeah, and as individuals both within and outside the LGBTQ plus community seeking ways to actively contribute, how can we collectively promote and support health equity for transgender people in our local communities and beyond?
Volunteer with organizations that are trans-led, and volunteer with organizations that support the health and well-being of transgender individuals.
And education and awareness stands as a powerful catalyst for change. How do you perceive their role in dismantling barriers to health equity for the transgender community?
When we do things like this interview, thank you so much for having me, this educates people on the trans experience. This helps to reduce the stigma and thereby make us a more inclusive and welcoming society.
Dr. Elijah Nicholas, thank you so much for your time and for telling our viewers about this.
Absolutely. Thank you for having me.
Of course, I'm going to let them know where they can go for more information. You can find out more by going to 100blacktransmen.com.